So hello friends, welcome back to my channel Medicine of 101. Today we'll talk about SLE, that means systemic lupus erythematosus. Okay, it's one of the most important, or you can say the vital topic as far as the rheumatology is concerned, because this disease, okay, this is related with the many organ levels. As far as the organ is concerned, system is concerned, we'll talk about all these things over here. Okay, so before starting the topic, let me tell you one thing over here, that the most common death due to the acute SLE, that's for the what? The renal failure. Okay. So we have to know as far as the question is concerned in the competitive exams. So let's write it over here, that the most common cause. So the most, okay, let's write it over death. The most common death due to acute SLE, and it's supposed to be here the renal failure over here. That means actually we will see over here the nephritis. For that we will see the renal failure over here. Now we will see the SLE in case of what? In case of the females. The most common, the most common symptoms we can see in terms of the females. So the SLE that can be seen in terms of the more in case of female. Now if you just compare the ratio as far as the male and female is concerned over here, we'll get around 9:1. Okay. Now why this type of the thing we'll see over here? Why this type of the dissimilarities, or what type? Why we'll see this type of the ratio in terms of the female? Now see, this is the SLE. The SLE that is directly proportionate to the number of X chromosomes. The SLE that is directly proportional to the number of X chromosome. Okay. Now try to understand. Basically, we know where in terms of the female there is more X chromosomes, XX. Okay. Now see, the SLE we can see also in terms of the Turner syndrome. See, in case of the Turner syndrome, we know what here we'll get 45A plus, will get X over here. Okay, so in these cases we can also get the SLE, or we can get also the SLE in terms of the Klinefelter over here. Here we'll get 45A plus XX. Oh, I see. There is a presence of the two X chromosomes, so the more chances for having, or the severity of the SLE will be over here. The severity for the SLE will get over in terms of the Klinefelter syndrome over here. Okay. Now we'll talk about what type of there are other ratios. Okay, let me just say one more thing over here, that this type of the ratio where the female will be more affected, this type of the syndrome, just like the SLE we can see in other types of the syndrome as well. Okay, so this type of the ratio, where can you see except the SLE? So you will get over here in the Takayasu. In Takayasu, here we will get the what? Renal, okay, arteriostenosis. Renal arteriostenosis. In these cases, we can get this type of the ratio. Another we can get over here, SJ1 syndrome over here. Okay. In these cases, we will get what? The dry mouth and dry face. Dry mouth and dry face will get over here. Okay. Now we talk about let me write it out clearly. SGO, SG gland. Okay. Okay. Now we'll talk about what type of the clinical manifestations we will get in terms of the SLE. Okay. So let's write it over here, the clinical manifestations. See. So as far as the clinical manifestation is concerned, if we follow the Harrison's over here for the internal medicines, we will see in Harrison it has been written that the most common types of the symptoms or the clinical manifestations as far as the skeletal muscles concerned, that's let me write it over here, that the musculo, okay, skeletal system is concerned. Here we will get arthralgia, that means we'll get this type of the pain in these regions. Okay, so arthralgia will get over here. We'll talk about it in details in the subsequent parts. For now, is the most common type of the symptoms we'll get over here. The next, as far as what if we see, as far as the hematology is concerned, what type of the thing we'll see. So whenever we are just talking with respect to the hematology, we'll get over here that anemia. Why we'll get the anemia? Because in these cases we'll see there will be productions of anti-erythrocyte antibodies that will destroy the antibodies, erythrocyte. As a result we'll see the anemia. Now we'll talk about the, as far as the dermatology is concerned over here, what type of thing we'll see. In these cases, the most prominent thing over here, we'll get the butterfly skin rash. Okay, so over here. Now see, in these cases, we will see the individual will have the skin rashes within this region, so in the cheeks. Along with the, we'll see over here, if you just see the the nasal junctions over here, in this cases nasal bridge over here, we'll get the butterfly skin rashes. Now, whatever the problem will be over here, whenever the individual, those who are having the ACL, whenever the individual will go out and whenever the individual will be in the sunlight, at the time, the itching type of the problem that will be started arising in the skin rashes. Now, whenever the individual in the sunlight, at the time the problem will be there. But whenever the individual is going from the sunlight to the normal place over here, okay, for example, in the shadow, still we will see there will be this type of the problem in the skin rashes over here. Okay, so in sunlight, we'll get over in sunlight and out sunlight. Okay. Now, other type of the clinical manifestations, as far as the dermatology is concerned, we'll get over here. Just within the chin, in this chin regions, we'll see in this chin region the whole regions. Okay, along with the central portions, along with the peripheral regions, we'll get that will be what we'll get the skin rashes over there as well. But don't get confused in these things with the antifungal infections. Okay, within the fungal infections, we'll get what these chin regions, that will be also we'll see the rashes, but the rashes that will be not seen the central part. We'll see only in the peripheral parts in the chin. So we'll see, write it over here. We'll see the rashes within the chin regions, but it will be covered all. That means centrally also. Okay. Now another term we'll get over here, that is known as podiasis. What is podiasis? Let me write it over here. Then I'm explaining that one. Podiasis is subacute cutaneous lupus erythematosus. So under the skin, we will get this type of the rashes over here. And sometimes we can also see the rashes in between the fingers in these joints, okay, in these portions over here. So what is psoriasis? Let me write it over here. We'll get that subacute. We'll get the subacute cutaneous lupus erythematosus. Okay. Now these are the the basic clinical manifestations we'll get as far as the ACL is concerned. Now we'll talk about in terms of the diagnosis. So whenever someone is having the the ACL, you are suspecting the individual is having the ACL. Now how can we just prove it, or how can we just make sure that the person is really suffering from the ACL? For that thing, so we'll get over here what we have to test the different types of the autoantibodies. Now see, I have already uploaded a video where I've talked about the ACL. The ACL is basically type 3 hypersensitivity. Okay, so what do we see in type 3 hypersensitivity? There we see that the formations of the antigen antibody complex. That means, see, whenever the antigen within the circulation in the free form, the antibody will come over here in the circulations in the free form, then both of them will get combined together. After that, they will form the antigen antibody complex. And whenever the antigen antibody complex will be formed, after that, they will just get deposited on the basement membrane. For example, in the joints, for example, with the glomerular basement membrane in the nephrons, the different types of the structures, they will just get deposited and they will cause the further immunological aspects what we see in these cases. Now we'll say, and as far as the diagnosis is concerned, so what type of the diagnosis you can do just to make sure that the individual is suffering from ACL. Now in these cases we'll talk about the autoantibodies. So let's write it over here. We'll get the different types of the autoantibodies. Okay. Now, and the antibodies that will be produced against the self antigens, so for own tissue. Okay, so in this cases, let's write it over here. The first and autoantibodies that will get over here, the anti-nuclear antibody. So anti-nuclear antibody. is the most prominent one. That means around 98% of this antibody will get in terms of the ACLE. So it's the most sensitive test, most sensitive one. Now see, if we get the anti-nuclear antibody, then we are not supposed to say the person is or the individual is suffering from the ACLE, because the anti-nuclear antibodies, this type of the antibodies can be seen in other types of the disease as well. In which type of the disease you will see the anti-nuclear antibody? Let me write it over the name. So I'm writing over briefly anti-nuclear antibody. Okay, that can be seen in terms of the scleroderma. We can see in terms of the ACLE over here, and you can also see. Okay, let me write it over clearly. Sjogren syndrome over here. In these cases, okay. Now the second type of the antibody, what type of the antibody we'll get over here? Let me write it over here. We'll get anti-Smith antibody. Anti-Smith antibody. Now try to understand. This is the most specific one. If we say the most sensitive, that it will be anti-nuclear antibody. In the questions, if it is given the most specific antibody, then you are supposed to remember that anti-Smith antibody. Most specific. Okay. Now another type of the test we can do over here. We can do the double stranded DNA, but as far as the antibody is concerned. Now this correlates. This type of the test correlates over here as far as the progressions of the disease. That means disease progression, just to check in which form of the ACLE we are getting in these patients. For example, a pregnant lady has come to the OPD, and we just when we know that the lady is suffering from ACLE, but the doctor is prescribing the steroid therapy. After that, we are supposed to know then which portions of the disease. Let me just let's write it over here. We are giving the steroid therapy. After that, we need to check in which conditions or in which phase the individual is. Okay, in these cases, just to check the progressions of the disease, we can do the test of what dsDNA over here. Okay. Now we'll just do the next type of the test, that is known as anti-RO antibody. Anti-RO antibody. Now this type of the antibodies, they basically just tested for photosensitivity. Okay, or another name for it, you can say SSA, single stranded antibody, just like this. Okay. So see, it is done just to check photosensitivity, because whenever this type of the antibody will be present over there, the individual have the in the problem as far as the skin disease is concerned. Whenever the individual will go outside in the sunlight, so photosensitivity. Okay. In both cases, we will get in terms of the what acute ACLE or acute. Now, if we see the person is having what the acute ACLE, then we will get the malar rash. We get the malar rash over here. And if the individual is in under the the subacute, we will get the psoriasis over here. So we will get over here psoriasis. We will get the psoriasis over here. Okay. Now see, the anti-RO antibody or the SS antibody, that comes under the IgG antibody, the class under the anti-RO antibody, that comes under the class of IgG antibodies. So whenever we will get this type of the antibody under the IgG class, now we know that this antibody that can cross the placenta. So whenever the IgG that can cross the placenta, similarly that anti-RO antibody that will go to the placenta, and whenever they cross the placenta, they will come to the fetus. And whatever the problem they will do over here, they just block the AV node. So whenever the AV node that will be blocked, why? We are getting the anti-RO antibody that will go through the placenta, it will go to the fetus. And whenever they will come to the fetus, they will block the AV node. And whenever the AV node will be blocked, only for the circulation's purpose or the heart pumping activity, only what will be left over here, the AC node and the Purkinje fibers over here. We can say the bundle of Hage. As a result, we will see these cases that will be not sufficient for the heart functions. So we will see over here the complete heart block. So we will get over here the complete heart block. And whenever we see the complete heart block, this type of the thing, This is known as neonatal lupus. This is known as neonatal lupus. And whatever the manifestations we will get over here, whenever after the delivery we will get the individual will have what the breath, the heart rate that will be slow over here. We will get the syncope, this type of the symptoms. So the in terms of the neonatals, we will get what bradycardia. Get the bradycardia, we will get just like the syncope over here. Okay, this type of the symptoms. Now to save the baby or just to prevent these things, what we are supposed to do, we have to put out the pacemaker. So for these things, we have to what? We have to use the pacemaker. We have to use the pacemaker over here. Okay. So in these cases, we can use the pacemaker. Now we'll talk about the different types of the antibodies. So at first I did talk about the anti-nuclear, then I did talk about anti-Smith antibody, DS, okay, DS-DNA, double standard. Then we just did talk about the anti-RO antibody. That comes under the class of IgG. So it will cross the placenta. That after crossing the placenta, whenever it will go to the fetus, that can block the AV node. Whenever the AV node will be blocked, then we will get the complete heart block. As a result, we can see this type of the thing, neonatal lupus. So whatever the symptoms will get, the bradycardia syncope. And just to prevent these things, or just to save the baby, we have to put the pacemaker. Okay, that's the thing. Now we'll talk about the different types of the antibodies. We'll talk about anti-LA. That means, let me write it over here. We'll talk about anti-lupus coagulant. Anticoagulant over here. Okay, let me use this one. Yes. So we'll write lupus anticoagulant antibody. We'll write it over lupus anticoagulant antibody. Now see, whenever we will see in these cases that we are getting this type of the antibody in terms of SLE, so there is a very less chance of the risk, that will be very less as far as the nephrology is concerned. So nephritis will not be seen in these cases, for example. Okay. So the nephritis cannot be seen, so the chances for having the nephritis is very less whenever we will see this type of the antibody, lupus anticoagulant antibody. Now we'll talk about the histone. Okay, so histone antibody, antihistone antibody. So antihistone antibody. Now antihistone antibody, try to understand, this type of the antibody will get where? In the drug induced SLE. So drug induced SLE. So let me write it over here. So drug induced SLE. Now what type of the drugs that can cause the SLE over here, you have to know. In terms of the, we know that CYP group of the drugs. So under the CYP group, what type of the drugs will get over here? So sulfur group of the drugs. Then we will get hydrolyzing. Then we will get what? Isoniazide. And we will get what? Procainamide. Okay. Okay, this type of the drugs that can cause the what? SLE. Now the procainamide, this type of the drug that is used where in terms of the arrhythmia. So anti-arrhythmic drugs. So we can write it over here, the procainamide over here, the anti-arrhythmic drug. And then the drug of choice of what? The drug of choice for Wolff Parkinson White syndrome. Okay. And the drug of choice LGL syndrome. That means Lon-Ganon-Levine. Lon-Ganon-Levine. This type of the syndrome. In these cases, we can use the whatever the drug procainamide. Okay. Now we'll talk about the different individual antibodies. More antibodies are also the autoantibodies. So let me write it over their name. So we'll get over here, for example, we'll get in these cases that anti-erythrocytic antibody, what I already said before. In these cases, we will get what? Autoimmune hemolytic anemia. Okay? Autoimmune hemolytic anemia. The next cases we can get anti-platelet antibody. Anti-platelet antibody. In these cases we will get the problem as far as the coagulation is concerned. So this type of problem we will get. Okay. Now see, in the exam sometimes some questions are given just like this, that if I say, I forgot to mention this one, if I say ANA, that means anti-nuclear antibodies, and there is one more antibody that is known as AMA, that means anti-mitochondrial antibody. So anti-nuclear antibody, that can be seen in terms of the SLE. Now when you are using the term AMA, that means anti-mitochondrial antibody, where can you see this type of thing? We will get this type of the antibodies in primary biliary cirrhosis. Biliary cirrhosis. In these cases we can get the anti-mitochondrial antibody. Okay. Now there are some types of antibodies against the central nervous system. So what type of the antibodies we'll get over here? Let's write the name of them. Okay. So we'll get anti-neural antibodies. Okay. So as far as the central nervous system is concerned over here, we'll get anti-neural antibodies over here. And the second time we'll get anti-glutamate receptor antibody. Okay, we'll get anti-neural antibodies. We'll get what? Anti-glutamate receptor antibodies over here. And the third thing we'll get over here, that's important on that anti-ribosome P antibody. Anti-ribosome P antibody. Now what type of the important thing over here, that this type of the antibody, they can cross the blood-brain barrier, and whenever they will cross the blood-brain barrier, that can cause the psychosis. So this can cause the psychosis over here. So what's the name of the antibody? Anti-ribosome P antibody. They will cross the blood-brain barrier and they will cause the psychosis in these cases. Okay, so this was all about the antibodies. In the next part of the video, we'll talk about what type of the treatment you can do in terms of the SLE. So this was all about the diagnosis and the general introductions. So if you think this video is helpful for you, please do like and subscribe my channels, and don't forget to share. See you in the next video soon.